Welcome. Today we're diving deep into lupus nephritis, a serious kidney complication arising from the autoimmune disease, systemic lupus erythematosus or SEL. We'll explore what causes it, how it affects the kidneys, its symptoms, diagnosis, treatment, and more. Let's get started! The underlying cause of lupus nephritis is systemic lupus erythematosus, an autoimmune disease. In SLE, the immune system mistakenly attacks the body's own tissues and organs, including the kidneys. While the exact trigger for SLE is unknown, it's believed to be a complex interplay of genetic predisposition, environmental factors like viral infections or sunlight exposure, and hormonal influences. Certain genes, such as those related to the immune system's regulation, increase susceptibility. However, having these genes doesn't guarantee you'll develop lupus. Environmental triggers are often necessary to activate the disease in susceptible individuals. Let's break down how lupus nephritis damages the kidneys. In SLE, the immune system produces abnormal antibodies called autoantibodies. These autoantibodies form immune complexes, which are essentially clumps of antibodies and antigens. These immune complexes circulate in the bloodstream and get deposited in the glomeruli, the tiny filtering units within the kidneys. The deposition of these immune complexes triggers inflammation. This inflammation damages the glomeruli, interfering with their ability to filter waste products and excess fluid from the blood. Over time, this inflammation leads to scarring, known as glomerulosclerosis. The damage to the glomeruli reduces kidney function, potentially leading to kidney failure. Lupus nephritis affects a significant portion of individuals with SLE. Studies suggest that around 40% to 75% of adults with SLE will develop clinical evidence of kidney involvement at some point during their disease course. The prevalence varies depending on ethnicity. Lupus nephritis is more common and often more severe in individuals of African, Asian, and Hispanic descent compared to Caucasians. Women are also significantly more likely to develop lupus and, therefore, lupus nephritis than men. The typical age of onset is usually between 15 and 45 years old, aligning with the peak age for SLE diagnosis. The symptoms of lupus nephritis can be subtle in the early stages. Some common signs include proteinuria, which is protein in the urine, often detected during routine urine tests. Hematuria, or blood in the urine, may also be present, sometimes visible but often microscopic. Swelling, or edema, in the legs, ankles, and around the eyes can occur due to the kidneys' inability to properly regulate fluid balance. High blood pressure is another frequent symptom, as kidney dysfunction can disrupt blood pressure control. In severe cases, lupus nephritis can lead to fatigue, weight gain due to fluid retention, and signs of kidney failure, such as decreased urine output and nausea. Diagnosing lupus nephritis involves a combination of clinical evaluation and laboratory tests. A thorough medical history and physical examination are crucial. Urine tests are essential to detect protein in blood. Blood tests are performed to assess kidney function, measuring creatinine and blood urea nitrogen (BUN) levels. These tests also help evaluate the immune system, looking for autoantibodies like anti-nuclear antibodies (ANA) and anti-double-stranded DNA antibodies (anti-DNA). A kidney biopsy is often necessary for definitive diagnosis. During a biopsy, a small sample of kidney tissue is examined under a microscope to assess the extent and pattern of kidney damage, helping classify the type and severity of lupus nephritis. Lupus nephritis is classified using the International Society of Nephrology of Renal Pathology Society, or ISNRPS, classification system. This system categorizes the disease into 6 classes based on the pattern of kidney damage observed in the biopsy. Class I is minimal mesangial lupus nephritis. Class I is mesangial proliferative lupus nephritis. Class I is focal lupus nephritis. Class IV is diffuse lupus nephritis. Class V is membranous lupus nephritis. And Class V is advanced sclerosing lupus nephritis. Understanding the class of lupus nephritis is crucial because it guides treatment decisions and helps predict the prognosis. Treatment for lupus nephritis aims to reduce inflammation, control the underlying autoimmune disease, and protect kidney function. Immunosuppressant medications are the cornerstone of treatment. These include corticosteroids like prednisone to reduce inflammation, and other immunosuppressants like mycophenolate mofetil, cyclophosphamide, and azathioprine to suppress the immune system's attack on the kidneys. ACE inhibitors or ARBs are commonly prescribed to lower blood pressure and protect the kidneys. In some cases, biologics, such as belimumab or rituximab, may be used to target specific components of the immune system. Regular monitoring of kidney function and medication side effects is crucial. Dietary modifications, such as limiting sodium intake, may also be recommended to manage fluid retention and blood pressure. Unfortunately, there's no guaranteed way to prevent lupus nephritis, as it's a complication of SLE, which itself has no known prevention. However, If you have SLE, there are steps you can take to reduce your risk of developing lupus nephritis or slow its progression. These include strict adherence to your prescribed medications, regular check-ups with your doctor to monitor kidney function, and avoiding potential triggers for lupus flares, such as excessive sun exposure. Maintaining a healthy lifestyle with a balanced diet and regular exercise can also help manage the disease and potentially reduce the risk of complications. The prognosis for lupus nephritis varies depending on the severity of the disease, the class of lupus nephritis, and the individual's response to treatment. Early diagnosis and aggressive treatment significantly improve the outcome. With optimal management, many individuals can achieve remission or control the disease and preserve kidney function. However, some individuals may progress to end-stage renal disease and require dialysis or kidney transplantation. Recent research focuses on developing more targeted therapies with fewer side effects. Clinical trials are exploring new biologics and small molecule inhibitors that specifically target the immune pathways involved in lupus nephritis. Additionally, research is aimed at identifying biomarkers that can predict disease progression and response to treatment, allowing for more personalized approaches to managing this complex condition.